So my name is Carolyn Baylor. I currently work at the University of Washington in Seattle, Washington. I am trained as a speech-language pathologist, and that term is really just the long way of saying I'm a speech therapist. And so I work with adults who have acquired communication disorders. So these would be adults who have had what we would say is typical communication for much of their life. And at some point in their life, they have had something happen, like a stroke, maybe develop Parkinson's disease or multiple sclerosis, perhaps have some type of head and neck cancer, something that has affected their ability to talk, their cognitive ability, their voice, anything that affects communication. And that can have a tremendous impact on people's quality of life. It can impact their work life, their home life, their social activities. And so in my lab, we work on things like developing evaluation tools, such as patient questionnaires, kind of more life-focused, life participation-focused assessment tools. And we think about how can we incorporate some of these things into intervention. So my goal is that my line of research will help new clinicians have the resources and the tools and the materials that they need to better implement this more holistic focus of therapy with their clients that they work with as they head into their own clinical practice. You know, so I really started in the field of speech pathology. I chose the major actually in high school at a career fair. So to all of you who attend career fairs and counsel high school students, thank you. I really got turned on to the field at that point. The field of speech pathology requires that people get a bachelor's degree and then a master's degree to work clinically. So I got that training and I went into clinical work where I worked in various rehabilitation programs, again, working with adults who have acquired communication disorders. So a lot of people with stroke, head injury, neurodegenerative diseases such as Parkinson's. I think that research is so important for areas of work that I focus on, which is really understanding the perspective of the person who lives with the diagnosis. So we can deliver what's called patient-centered or person-centered care. And historically, what would happen in healthcare, including in speech pathology, is researchers and clinicians might say, well, you know, I have worked for 10 years as a therapist, and I've met with hundreds of patients, and I know what they need. I know best. I'm a healthcare provider. And we have really been humbled in that attitude over and over and over again by being told by our patients that no, as healthcare providers, you really don't understand exactly what the patient is experiencing or the patient is feeling or the patient is wanting. And so we have really made a big push across all healthcare professions in recent years to say, we really need to partner with people who live with these diagnoses to have them inform us what's important to them. What are they looking for in treatment? What should we prioritize? What works and doesn't work for them? And going into research such as qualitative research, where we bring scientific rigor to the patient experience, or patient-reported outcomes, where again we develop better ways of of understanding and collecting patient perspectives, has really been essential for guiding the direction that research goes. So we can be sure that we're not just sitting here and saying from an academic perspective or a healthcare provider's perspective, what's happening, but that our work is really guided by people who live with the diagnoses. I really want people to know how incredibly valuable each participant's input is for a research study. I think that sometimes it might be easy for people to become jaded and say, oh, the researchers don't need me. Oh, there's, millions of people who live with my diagnosis. Somebody else can do it. Somebody else can join that study. And for many of our conditions, especially that we work with in speech pathology, our populations are really small. Some of our diagnoses would be considered rare diseases. Others are not so rare, but the constellation of people who live with specific communication challenges is pretty small. And so each and every individual that participates in a study is really making a unique and meaningful contribution to helping us understand what is life like for you. So I would really like people to know how deeply we appreciate them giving of their time, their insight. You know, they really give of themselves, and it is a genuine help. When I have research participants say, "I'm so glad you asked me that." For example, in one of our studies we are currently running, you know, some of the experiences that we are asking people to share, both themselves, and we're inviting family members into this study as well, we get several comments back saying, "Nobody's ever asked me that before. I'm so glad that you asked me that." And what that tells me is that we really haven't yet fully understood what people are living with when they live with various communication disorders. And that means we have a lot more that we have to learn. And it's important, I think, for people to feel seen and heard and understood, because, you know, living with so many health conditions brings so many challenges. And if somebody, I think, can feel seen and heard and understood, maybe it just helps them to have some hope for progress or empathy or understanding. And so that might not be a huge, you know, impact on the rest of the world, but it really makes me feel good as a clinician and a researcher when somebody says, you know, "Thank you for asking. I'm so glad you asked. These are good questions." I think that on the broader perspective, broader reach of our research, one of the key tools that we've worked on in terms of developing what we call patient-reported outcome or persons-reported outcomes, questionnaires to use in clinical use, we have noticed that the questionnaire is starting to be picked up and used in more hospitals, more clinics, in more research studies. And we get feedback that people are saying it's helpful. It gives us a new way to understand what's helping with our patients or happening with our patients. And so it is exciting to get those calls to say, "We'd like to use your tools. We'd like to incorporate them into our medical records, into our clinical protocol." So that is exciting to see that starting to happen. I do want to say ResearchMatch has been very, very helpful. I think particularly because I have a small lab, we have relatively small budgets. It's really hard to get that reach, especially to go nationally, where we really want to bring a very diverse, you know, array of people into our studies so we can capture as many people's experiences as possible. And it is really hard working as an individual researcher to be able to go out and find people all over the country, especially for some of these diagnoses that are not very common, to be able to invite them into our studies. So having tools such as ResearchMatch that is set up, it's so helpful, it's easy, that can just partner with you to say, "Hey, we can help unload some of that burden of getting the word out about your study and recruiting." It's really just so incredibly helpful to researchers that it's really just a gift. That's the best way to think of it. It's just a gift to have this resource available. So thank you.